Concern, but not alarm. Governor Corzine says that's the headline he wants to convey about New Jersey's H1N1 flu strategy. The governor's plan announced today includes offering free swine flu shots to the state's 1.3 million uninsured. NJN News health and medical correspondent Sarah Lee Kessler reports.
1, 2, 3.
At a ribbon cutting today to celebrate the opening of Newark's newest school, Park Elementary, Governor Corzine revealed an important new element in the state's swine flu strategy: free vaccine for uninsured New Jerseyans.
If they are uninsured, they will be able to access the vaccination for free. And if they have health insurance, as I said, we've got a work in progress. We'd like to see no copays on that.
All that talk, of course, is hypothetical. The vaccine is still undergoing clinical trials to confirm safety and effectiveness, but those tests are said to be going well, and Health Commissioner Heather Howard expects the federal government to start shipping up to 1 million doses to New Jersey beginning in mid-October.
There were going to be public health clinics in all 21 counties. We know that fairly qualified health centers are stepping up to the plate, and all 93 sites will be offering the H1N1 vaccine. So really, we can assure the people that everyone who needs it will have access.
The shot is voluntary, and the big question is, how many people will want it? I spoke to pediatrician Jeffrey Boskamp, an infectious disease expert at Hackensack University Medical Center.
I think that, people have to respect the possibility that this is a new virus, that it could be dangerous. We don't think so, but we do think that, if we can immunize a good percentage of the public, that we can really minimize the problems with this virus.
Dr. Boskamp also participated in the governor's news conference.
We're also going to get the message out that you need to stay away from people who are sick. And instead of closing schools, the key thing is to get the sick kids out of school, not have them come to school.
You want to keep all those children who are well in school and learning. If we close the schools, then we send all the healthy children home. And all they're going to do is congregate with their friends in other locations. They're far better off in the school learning.
Yesterday was Wednesday. Great. Wilbur.
In fact, the new guidance from the CDC, based on the nation's spring experience with H1N1, says schools should close only as a last resort. The nursing staff at Park Elementary says it's ready for the flu, swine or seasonal.
I will determine their symptoms here in this room, and then if I find that they're febrile or they have a cough, I will then mask them and take them to a quarantine room within the health suite.
There are medically fragile children here.
Medically fragile referring to children with cerebral palsy, physical disabilities, or kids who are immunocompromised. The school nurse said there are 25 such children here out of 700, and that all it would take is 2 days of 6 or 7 children presenting to this office with flu-like symptoms for a recommendation to be considered to close the school.
It's not something you'd normally think about on the first day of school, but the ongoing pandemic makes this an unusual time.
What do we want everyone to think room 111 is? Amazing!
The school says part of its anti-flu strategy will be to teach proper hand washing. Sarah Lee Kessler, NJN News, Newark.